Good evening. Welcome to this edition of the 411 Talk Song Radio Show. My name is Leon Jones. Tonight, I'm going to talk about the symptoms of ADHD. I'm going to talk about the symptoms of ADHD. Of course, a number of us know ADHD as a form of adult deficit disorder or attention deficit disorder. You've heard those terms come at you from a mental health aspect. Well, when we talk about ADD or ADHD, one must understand that the disorder, of course I'm talking about ADD or ADHD, is divided up into three categories of symptoms. First being inattention, then there's hyperactivity, and there is impulsivity. Now, when one has inattention, one might not notice it until a child goes to school. In adults, it may be easier to notice at work or in social situations. A person might procrastinate, not complete tasks like homework or chores, or frequently move from one uncompleted activity to another. They might be disorganized, lack focus, have a hard time paying attention to details, and a tendency to make careless mistakes. Now, this might be messy and seem careless. There's also a chance that a person with this disease, ADD, may have trouble staying on topic while talking, not listening to others, and not following social rules. Beside that, that can lead to, we call it stubbornness. I'm going to take it even deeper than that. That's narcissism. And that fact, because a number of people that may be classified with other disorders like ADD could also be narcissists. Now remember, I've always said that all mental disorders connect one way or another. And with ADD or ADHD, you can be forgetful about daily activities like missing appointments and forgetting to bring your lunch to work. You can be easily distracted by things like trivial noises or events that are usually ignored by others. Now, when we talk about the hyperactivity, it'll vary with age. One might be able to notice it in preschoolers. Now, ADHD symptoms nearly always show up before middle school. Kids with hyperactivity may fidget and squirm when they're seated, so they're basically restless, get up frequently to walk or run around, run or climb a lot when it's not appropriate. In teens, it's basically restlessness. Children may have trouble playing quietly or doing quiet hobbies. People with ADHD can always be on the go, and excessive talking is involved. Now, toddlers and preschoolers with ADHD tend to be constantly in motion, jumping on furniture, and having trouble participating in group activities that call them to just sit still. For instance, they may have a hard time listening to a story. School-age children have similar habits, but you may notice those less often because they are unable to stay seated, they squirm a lot, fidget, and they talk a lot. Hyperactivity can show up as feelings of restlessness in teens and adults. They may have a hard time doing activities when they're required to sit still. Now you have impulsivity. Now, these symptoms include impatience, having a hard time waiting to talk or react. When a person has ADHD, have a hard time waiting their turn. Now, I'm still on impulsivity. They blurt out answers before someone finishes asking them a question. Very normal. A number of people do that. Frequently interrupt or intrude on others. This often happens so much that it causes problems in social or work settings. People with ADHD, with the impulsivity, tend to start conversations at inappropriate times. Impulsivity can lead to accidents like knocking over objects or banging into people. Children with ADHD may also do risky things without stopping to think about the consequences. For instance, they may climb and put themselves in danger. Many of these symptoms happen from time to time in all youngsters, but in children with the disorder, they happen a lot, at home or at school or just visiting with friends. They also mess with the child's ability to function like other children who are the same age or on a development level. Now, with any disease or disorder, can you get diagnosed? Absolutely. So when you go to a doctor, they check for behaviors that aren't typical for the person's age. Now, most children can behave in those ways at some point or another. Doctors will check the negative impact on a person's ability to function at home, in social environments, or at work. They also, and I'm talking about doctors, have the consistency to display at least 6 of the symptoms that I mentioned for at least 6 months and at least 2 settings, such as at home or at school. Again, you're hearing a lot of repetition because I always tell you that repetition is the mother of all skills and the mother of all teachings. Now, when it comes to ADHD or ADD, the long-term outlook is this way. Overall, when it comes to hyperactivity, tends to diminish with age, but inattention tends to last into adulthood. Treatment can help, and a great many children with ADHD ultimately adjust. Some, about 20 to 30%, have learning problems that ADHD treatment may not help. As a child grows older, some teens who have the disorder since childhood may have periods of anxiety or depression. When there are more demands at work or at home, symptoms of ADHD may get worse. A child with hyperactive behavior may get symptoms of other disruptive disorders like oppositional defiant disorder. Now, these children are at risk to be more likely high school or school dropouts, period. In other words, what I'm saying is children who have this oppositional defiant disorder, they're more likely to drop out of school. Now, if one is concerned, talk to your child's doctor about the treatment options. Now, medications, behavioral therapy, and other tactics can help. Now, what I'm going to tell you is there are a number of people who have ADHD and we don't know it, particularly school-age children. But what some of these schools do to these children, and I know I had a son, he had it, and all they kept feeding him was Ritalin. Ritalin is not going to help. What children need is the treatment, particularly boys. They are rambunctious at a certain age, and a lot of this behavior starts at home. So first, what anybody should do is get counseling. And I don't understand why individuals, particularly in the African American community, and I'm not picking on the African American community, but our community seems to have the most problems when it comes to any type of disorders. We just have this idea that we don't have them, but we do. And this is what's destroying us inside and out. If you have children and they're going to school, you don't need to shoot them up with Ritalin. It's not going to help. What you need is a doctor to diagnose the problem. Children need counseling, just like adults. And if you don't catch it now, while a child is still developing, a child's going to be a Frankenstein and uncontrollable. And this is where parents, they start to become impatient with the children's behavior. because it can be rough when you don't diagnose this disease when a children or child is young. And let me tell you where ADHD can lead to. Can lead to anger and other emotional problems as well. One must forget that, you're going to hear me repeat this over and over again. When anybody has a disorder, whether it's an anxiety disorder, bipolar disorder, somewhere down the line, you're going to find something that you heard that's familiar, like narcissism and schizophrenia and anger. Well, when a child is rambunctious and has ADHD, these behavior patterns will show. So the best thing to do as a parent, or even as an adult, get help as soon as possible. Because if you don't get help, besides hurting others, you're hurting yourself. And it's always good to be educated with the disorder that you have, so you know how to manage it. That's basically why I do a number of these videos. I'm a civil engineer, but I work with people who tend to forget. They have problems focusing, sleep disorders. Why? Because at home, they have refused to get help, and it shows in their work performance. And this is when individuals give up on life. Do I believe they want to give up on life? No. Some of them are fearful to ask for help because of the backlash that they will get from friends or family. Well, if your friends and family are giving you backlash for asking for help, maybe they need to see a counselor themselves, because they have issues with self-absorbedness or narcissism themselves, because there are too many children out there with ADHD. Of course, have a son who had it. They keep shooting him with Ritalin, and it didn't help, and it still doesn't help. What helps any child is counseling and understanding what the disorder is. Trying to use any type of Ritalin as a scapegoat really enhances the problem. So what I'm telling all the adults and even some children out there, particularly teenagers, before any problem gets worse, it takes pride to get help. You'll be more respected if you get help. And there are people who will help you. But you have to want to be helped. And you have to tell yourself, I have a problem. Because it takes more of a man and a woman to admit that you have a problem than to just sweep it under the rug. In fact, generations have been sweeping disorders under the rug for a long time. Now it's time to get some clarity with ADHD. And that's my topic for this edition of the 411 Talk Zone radio show for this evening, Monday, May 15th, 2017. You can tune into the 411 Talk Zone radio show every Saturday from 6 p.m. to 8 p.m. on Blog Talk Radio. Guest calling number is 215-383-5785. This Saturday's Blog Talk Radio show, I'm going to talk about narcissism. Last week, I talked about schizophrenia. You can go to my Facebook page and hear the whole radio show. It's archived in its entirety. And it was a good show. And you might want to listen to it because there is a lot of information that I put out on schizophrenia. And I'm going to put out a lot of information on narcissism. And if you want to know more about narcissism and even become educated and learn about narcissism, go to the Truth Hurts the love doctor, Andrew Benjamin. This is his baby. He talks about narcissism all of the time. Go to his Facebook page, his YouTube channel, and you will learn a lot. But you got to be willing to listen. But if you want to listen to what I'm going to present about narcissism and self-absorbedness and selfishness, you got to tune in. Guest call-in number is 215-383-5785. And if you like my videos, please share and subscribe to the 411 Talk Zone radio show right here on YouTube, so I can continue to give you quality information for educational purposes from a professional and mature perspective. And folks, you have to excuse me tonight. I work as a civil engineer. I do project management. Just came back from a paving project for the Indiana Department of Transportation, and it was hot out there, so I am a little tired. So it took my all to do this video tonight. I wasn't going to do it, but for my subscribers and for anybody else who was interested in ADHD, I wanted to take time and do it. And after I finish this, I'm going to hightail it to bed because I have to get up for another 12-hour day tomorrow. Just wanted to bring that bit of information to you as my audience, because this video, I'm going to tell you the truth, it's not my best, but again, I'm human. Everything is not going to be scholarly, but you'll get the information that you need. So please bear with it. And that being said, on my YouTube channel, I don't engage in controversy, debates, or unnecessary emotional issues, nor do I participate in bickering or drama. Why? Because it's counterproductive. I'm here to teach, and the information that I'm giving you is going to help you survive in the real world, because the real world is very challenging. And I like to take my time to educate, because I'm giving you my research and my experiences just to add as an alternative to help you succeed and not struggle, because knowledge is power. If you have a business, a YouTube channel, and a topic that you would like for me to discuss on YouTube or Blog Talk Radio, please email me at lej6521@gmail.com. And if you have a comment, I like comments, please leave your comment in the comment section under the video. But make sure that your comments are pithy, no bloviating, pettifogging, or filibustering if you wish to opine. Now that's it for this video. Till next time, my name is Leon Jones. Remember, please be gentle and respectful to each other, and have a wonderful and blessed evening. Good night.